Ever wanted to do a C-section, baby? Well, here we go. C-section by Google Dictionary defines it as a cesarean section. Don't know what that is? Good. A cesarean section is a surgical operation for delivering a child by cutting through the wall of the mother's abdomen. Abdomen. The part of the body of a vertebrate containing the digestive organs, the belly, in humans and other mammals, is bounded by the diaphragm and the pelvis. Okay? Don't know what pelvis is? That's fine. A pelvis is the large body bone structure near the base of the spine, which hind limb and leg contact for humans and many other vertebrates. Don't know what vertebrates are? That's okay. A vertebra, in the layman's term, is each of the series of small bones forming the backbone, having several projections of articulation and muscle management. You know what? Forget this. Hey guys, my name is Zach, and welcome to another surgery squad surgery C-section surgery. Yeah, it's gonna be a lot of fun today, and I've never done this before, and I don't know much about C-sections, but what I just read to you guys on Google, and the fact that it comes out of the woman's butt, so we're gonna be doing some butt stuff soon. That's not right? Okay. Well, I made myself look stupid enough. Let's just get started. Okay, this is a big mistake. Thanks for watching, and I'll see you next time. Peace! Just kidding. Let's get this over with. Oh, warning. The surgery may contain graphic procedures, if you hadn't noticed, and inappropriate for children or squeamish adults. So if you're squeamish, enjoy. Okay.
Welcome to Surgery Squad's virtual cesarean section.
Nice to see
I'm
you
Dr.
again,
Jeff,
Dr. Jeff,
and I'll be guiding you through this surgery today.
All right.
A cesarean section, commonly referred to as a C-section, is an inpatient procedure where a surgeon makes incisions in a woman's abdomen and uterus to deliver a baby. This procedure is often performed when a physician determines it to be a safer delivery option for the mother, baby, or both. As with any surgery, the use of alcohol and tobacco increases the time it takes to recover, and if the mother has used alcohol or tobacco products during her pregnancy, it can also cause serious birth defects. Our patient today is in her early 30s and is relatively healthy, with the exception of a brief history of high blood pressure. Luckily for us, we get the opportunity to deliver her first baby. Now that we've covered the basics, let's scrub in.
All right.
We'll begin the procedure by inserting an IV into our patient's hand so that we can provide her with any medication and fluids she may need.
We gotta do some needles.
I've already tied a tourniquet on the patient's upper arm. Can you find a suitable vein in the patient's hand?
I see a thick-ass vein right here. I could probably jab into.
Looks good to me.
All right.
Next, we need to sterilize the insertion area using an alcohol wipe.
Click and drag the alcohol. Oh, so I'm just wiping off that needle right there. Okay.
Now that the area is disinfected, it's time to insert the needle and advance the angiocatheter into the vein.
Don't know what
any of that
means. Literally, take a stab at it. This is how you do heroin.
The small burst of blood that you just saw in the angiocatheter hub is known as a flashback. This lets us know that the angiocatheter is correctly positioned in the vein.
Okay.
Now, I'll release the tourniquet. While applying gentle pressure over the vein to collapse it, you can remove the needle. This will reduce the amount of blood that may pour out of the angiocatheter while the needle is removed. Once you remove the needle, I'll properly dispose of it in a sharps container.
In a sharp container. Click on the needle to remove it.
I'll lock the IV tubing to the angiocatheter by rotating the locking mechanism. And finally, we need to secure the IV with tape and test the IV line.
This is
excellent job. Was it easier than you thought it would be?
Yeah.
In order to reduce the amount of discomfort our patient may have, we'll be giving her a spinal anesthesia. This differs from an epidural in that we'll be injecting the anesthetic directly into the spinal fluid that surrounds the spinal cord, and there's no catheter involved. First, clean the area using iodine-based antiseptic solution.
Ooh, I like your back moles, lady. It's pretty hot. Click and drag the alcohol to wipe the sterilized area. Oh, that's some orange-colored alcohol. It's pretty hot. Ooh, I'm really into this stuff, boy. Is it clean enough?
Next, we'll inject a local anesthetic to decrease the pain the patient will feel when we inject the spinal anesthetic.
A local anesthetic? What if it's an out-of-town anesthetic? That wasn't English. I'm sorry, people.
So far, so good. Now we need to inject the spinal anesthetic directly into the patient's spine.
There's a skeleton inside her! Run away! Okay, so
now just place a bandage over the injection site and we'll move on.
Sweet.
Great.
Now what?
Before we can make any incisions, we need to clean the patient's abdomen with an antimicrobial iodine solution.
Ooh, that's pretty hot, baby. Click and drag the applicator to apply iodine. Isn't iodine salt? Hey, lady, we're gonna salt you up real good. Ooh, that's a new style. Gonna make an arrow. Enter through here. I'm horrible. I'm sorry. That's actually really funny though.
Now use the scalpel to make the abdominal incisions. As the incisions are made, you'll need to separate the layers of tissue, fat, and muscle.
Okay.
Are you ready?
Okay. Here we go.
It's getting a little messy in there. Use the suction to clear out some of the excess blood and fluid.
Oh, this is so gross. Really? Really? You gotta make that sound? I don't like it. I don't like it. I don't like it.
Insert the retractor to push down the patient's bladder.
Oh, hell no. Oh.
Make an incision into the patient's uterus so that we can begin the delivery. Be careful though, we don't want to accidentally injure the baby.
Drag the scalpel. Oh, okay, we'll just stab right into that.
We're almost there. Sometimes a surgeon will need to use forceps to help the baby out, but not in this case.
Okay.
The next step is to apply pressure around the baby's head to assist us in removing the baby from the uterus.
Where's the head at? Oh, that's the baby head.
Before we completely remove the baby from the uterus, use the suction bulb to suction fluids from the baby's nose and mouth.
What? What? Baby! I'm sorry, baby. Oh, God.
Now, let's have a baby. Help me remove the baby from the uterus.
Let's just... Digging up them holes, digging up them holes, yeah. Ah!
Excellent, but we're not done yet. Clamp and cut the baby's umbilical cord in order to detach it from the placenta.
Shut up, baby. I'm trying to do doctor stuff. Ew. Stop it.
It's a girl. Congratulations. Our team of nurses will take the baby to be cleaned, weighed, and examined before allowing her mother to hold her. In the meantime, we need to remove the placenta.
Oh, no. I thought we were done. What the fuck is that thing?
To finish up, we'll need to close the incision sites. I think we'll go with absorbable sutures instead of surgical staples to reduce discomfort and so that our patient doesn't have to worry about having them removed. You can take it from here.
That was the worst sound I've ever heard. No more sound. No more sound. Okay, I think we're done. Oh, why did I choose to do this? I could have done any surgery. What am I doing now? What am I... Okay. Why did I have to choose a C-section surgery? This is so gross. Oh my god. Can we hurry this up, man? I'm in shock now. It's so nasty. I don't ever want to do this again. Why do I keep pushing myself to do these surgery videos? We done here?
You did an amazing job.
Yay.
Now, the
I'm
recovery
never being a
process
doctor
begins.
again. Okay.
Since it may take a while for our patient to recover from the
Is that the
surgery,
baby?
her physician recommended that
This
she
is
plan
your
ahead
life.
by getting people to help her with
This is
daily
your
tasks,
life.
such as grocery shopping, cleaning the house, or yard work.
I have
It
a
takes
maid
roughly
for that.
6 weeks for the C-section incision to heal.
No one drinks coffee
And during
like
this
that.
time, our patient can expect some fatigue and mild discomfort. It is also recommended that during the
Uh-oh, they're
recovery
gonna drop
period,
that baby.
patients get plenty of rest, drink lots of water, and avoid intercourse.
Why
Our
not?
patient will need
Why
to
can't
contact
we
her
have
physician if
intercourse
she experiences
and drink
any
water
signs
at
of
the same time?
infection,
What's wrong with that?
foul-smelling discharge, painful urination, or
Okay.
leg pain or swelling.
Okay.
It is also highly recommended that she contact her physician
can't
if
be
she
a
is
doctor.
frequently depressed, as this may be a sign of postpartum depression. And that
I
is a
think that's whole
C-section.
nother problem there.
I think you should test your surgical skills in another surgery
I'm
here
gonna
on
spit on your face. I will never
surgerysquad.com.
do that again. I can't keep doing this, man. I need to feel happy. I gotta look at some happy things. This is horrible. I need to feel better. Oh, look at that one. Look at those. They're so cute. Okay, guys. Well, I need to recover. Maybe go to bed after this or something, because this broke me, man. This really broke me. But I didn't have a lot of fun doing this, but I had a lot of fun recording this for you guys, if that makes any sense at all. But thank you for sticking around. Thank you for watching. If you guys liked the video, leave a like. And if you want to see more of this craziness, leave a subscribe. Yeah, leave a subscribe. All right, anyways, thank you guys so much for watching, and I'll see you next time. Peace.